Okay, Mr. Wilson, feel free to press your call bell if you need anything. I'll see you in a bit. Hey, Lauren, is this chair taken?
No.
No? Do you mind?
Yeah, not at all.
Okay. Jeez, busy day today, huh?
Yeah, tell me about it. We don't get enough credit. We are already flooded with patients because Jessica called in sick and Steve is just trying to pass the buck of his patient assignments on to me. I just want to go home, but the patient in room 6,
Oh, the gentleman, right? What about him?
he's just so needy. He's been getting on my nerves all day. He's just a homeless IV drug seeking person. He's constantly complaining about his pain. I need this, I need that. I'm already busy enough. And he's yelling at me he's just driving me nuts.
Yeah, I get it. I think I've cared for him in room 6 before. From how I see it, I think he's honestly just going through a lot of adversity in a time like this, right? I mean, did he specify what kind of pain he was in? Did you do an PQRST kind of assessment, or what's going on?
No, someone just him probably just needs a fix or something, whatever.
Yeah. I can understand why you'd assume he totally needs a quick fix or whatever, but we shouldn't reduce his being as a whole person to just a homeless IV drug user. You know what I mean? And maybe his fix actually isn't as quick and easy as you would think. Homelessness throughout Canada is a chronic socio-political issue right now, and there's usually 1 or 2 comorbidities that exist with people who struggle with homelessness, right? And drug use is unfortunately one of them.
Yeah, I guess so. I think I'm just stressed out because he's so needy.
Yeah. Can I give you maybe a little bit of advice?
Yeah.
Honestly, hopefully just to reduce your stress. Maybe you can go home early like you want to too, and improve the care for the gentleman in room 6. So.
Yeah, I'm listening.
Okay. I'm just going to kindly advise you to look at him in the situation holistically. Start with providing person-focused care for him. Focus your attention on him and his needs specifically. Put the person first, if you know what I mean. Ask questions like, why do you think you're experiencing this type of pain? Why are you seeking high alert drugs specifically and not just Tylenol? You know what I mean? Advil, stuff like that. When we demonstrate our effort to know the root cause of a person's problem, we can better empathize with their patients and the context, culture that shapes them for who they are, and therefore avoid problems like labeling and stereotyping them and calling them homeless IV drug users. You know what I mean?
Mm-hmm.
It's a little bit overwhelming. Oh, I know. But, however, to get to the bottom of his needs and to ensure that he's receiving comfortable, safe care, we have to prioritize giving culturally safe care too, right?
Yeah, that's true. I didn't think of that before.
Yeah, I totally understand. I mean, with Jessica calling sick, and we know how Steve is passing the buck to us sometimes, it can be so busy on the unit that you forget to kind of look at them holistically, right? Mm-hmm. Another thing I'm going to advise you on is to read his chart and inquire if he has consultations specifically with psychiatric departments and social work. Reviewing the chart and the history can help you access the context of his life right now in many different ways, such as his history, economic status, sociopolitical status, and physical health and health history to help develop a foundation for who he is and what his care needs are. I'd also advise for you to inquire if he's had consults with psychiatry and social work. These 2 departments are useful to branch out and inquire if there are any determinants of health socially that are outside of the hospital setting that can contribute to his declining health and lack of pain management skills, right?
Yeah. We've all been so busy today. I couldn't imagine myself sitting and talking to him, taking that time to look up his history and his consults, but I see how it's important. I should do that.
Yeah. Even though, even going out of our way to do this can kind of put the puzzle pieces together for yourself, right?
Yeah.
You might spend a whole day thinking, he's so needy, I don't know why he needs this stuff and whatever, but when we understand our patients' stressors and their needs by going out of our way and doing a little bit of research on them through their history, consults, charting, etc., we can provide care that's much more empathetic, holistic, and thorough. As your colleague, I can understand how difficult it can be to provide care for someone that's in a completely different cultural context than you are, right? Mm-hmm. And how people's words and actions can negatively dictate someone's experience during their hospitalization. As your colleague, and as your friend too, I'm asking you to please try and look at the gentleman in room 6 as someone who needs holistic person-focused care and not just someone who's an IV drug seeker and looking just for a fix. Like I was saying earlier, when we reduce someone's being to just a label, we're demeaning their existence and their healthcare needs, which is obviously unfavorable for us as nurses and for them as patients in our care. And that fix that he could be wanting could be something that's more than meets the eye. with a more thorough assessment of him and his needs, I think you would also feel more comfortable working with him as a patient too, and feel like he's not agitating you as much throughout your 12-hour day shift. Mm-hmm. It's a long day, right? You can do this. I believe in you.
Thank you. I appreciate the kind and encouraging words. It's a breath of fresh air when colleagues come and support you, knowing that they won't judge you no matter what.
No, of course. It's nurses. It's what we do, right? Review the chart. Go through another assessment for the patient, holistically do another pain assessment, ask him what he needs regarding his context and his culture overall, and tell me how it goes. Let me know if you need help with anything, okay? I've looked after him before too, so.
Okay, thanks, I will.
You're welcome.